You're going to have total knee replacement surgery. The purpose of this program is to show you how to prepare for surgery, what to expect while you are in the hospital, and what exercises you will continue to perform at home. The care that you receive may vary from that shown depending on the specific instructions of your doctor. Patients who are prepared for surgery and who take part in their care can recover in less time and with less pain.
Well, my situation was probably a little different than some. I fell down the stairs and I was not able to wait there at all for 10 months prior to my surgery. So I was on crutches for 10 months. Of course, because of that, I've not been able to do many things. Even standing at the sink to do the dishes was almost an impossible task. I wasn't able to get out and walk. I couldn't garden. I couldn't do most of the things that I would normally do. Since the surgery, the improvement has been astronomical. It's just been amazing. I've been able to do pretty much everything I could do prior to my fall.
In a total knee replacement surgery, the surgeon replaces the damaged joint with an artificial one. The ends of the thigh bone and shin bone are covered with metal shells and separated by a plastic lining. The artificial joint is secured to the bone with quick hardening cement. If the kneecap is damaged, it may be lined with a plastic disc. Your skin is then closed with staples. This surgery takes about 2 hours to perform. Your new knee joint works the exact same way as the original joint. Much of the strength and mobility of the replaced joint is dependent upon you. This is why you are asked to start exercising before the surgery and continuing through until full recovery. The length of your stay in the hospital will be very short. You will be told what you need to do before and after you leave the hospital to continue your recovery. There are many things you can start now to prepare you for surgery. You will be shown strengthening and stretching exercises to improve your strength and flexibility. We may discuss other forms of exercise that would be beneficial for you. We will also determine what equipment you will need at home. This will include a walker or crutches, and may include a raised toilet seat and bath bench. Visits to the physiotherapy department are essential for good post-operative results. We will also want to know where you are continuing your physiotherapy after discharge. If transportation is an issue, we can arrange for paratranspo. A healthy diet prior to and after your surgery will assist with good healing. You will come into the hospital for a medical examination a few weeks prior to surgery. This will ensure that you are medically ready to undergo surgery.
You will need to make sure you prepare your home to ensure your safety while recovering after surgery. Ensure hallways and rooms are free of clutter and tripping hazards, such as scatter rugs or footstools. Remove loose wires or cords from areas you walk through to get from one room to another. Tuck away phone cords, but make sure you can still access your phone. A portable phone can be helpful. Another important suggestion is to add non-slip surfaces to outside stairs and walkways, or install stair railings and make sure the existing ones are secure. You will also want to remove indoor throw rugs and think about installing rugs with rubber backing. Bathroom or a portable commode on the same floor where you will spend most of your day. You can also modify an existing toilet by adding a raised toilet seat. You may want to install a few small handrails in your bathroom and bathtub to assist you in moving around and getting in and out of the tub. Make sure you can reach everything you need without getting on your tiptoes or bending down low. Put food and other supplies in a cupboard that is between your waist and shoulder level. Also, place glasses, your teapot, and other items you use frequently on the kitchen counter.
I've always got a phone here beside me on the table, my TV remote for whenever I'm ready to watch TV, my glass of water, my Kleenex, so I've got everything at hand.
Fix any uneven flooring in doorways. Use good lighting. Have nightlights placed in hallways and rooms that can be dark. In summary, Some of the important things to do in preparing your home are removing tripping hazards, adding non-slip surfaces, having firm chairs with arms and a side table available, using a firm foam cushion for low chairs, and stocking up on home and personal supplies.
That. I was anxious to get home and get moving, so I asked my doctor, when can I start driving even, because I wanted to get going. He says, once you can move that knee back and forth, the way you can, before your surgery, then you can start driving. Well, I was then bound to determine I was going to do my exercises faithfully, and I did. It is so important because you can get back to normal in no time. And I would come home and 3 times a day I would do my exercises, do my knee bends, walk. I would do everything I had to just to get those knees going, or that one knee going again. The fun part was going to physio at the Queensway Carleton Hospital, because there were a whole bunch of us there going through the same thing, and you'd go through all the different exercises.
When you wake up from surgery, you will have a large dressing over your knee, which is removed on the first post-operative day. Your incision is closed with staples, which will be removed later in your recovery. Your blood pressure and oxygen level are also monitored carefully on the first post-operative day. You will have a pain pump, a PCA, that allows you to control your pain medication through your intravenous line. You can get pain medication at frequent intervals, but there is a lockout on the device, so you cannot give yourself too much medication. Pain is measured on a scale of 0 to 10, with 10 being the worst pain you have ever had. Pain should be below 5 so that you can continue to do your exercises and mobilize. It is very important to use the pain medication regularly. After the PCA pump is removed, you are given oral pain medication and you will receive a prescription for this upon discharge. Your first time up in the hospital will be with a physiotherapist and a rehabilitation assistant.
Okay, Darlene, we're going to be getting you out of bed, so I'm going to help you with your operated leg. You're going to pivot yourself around and you're going to sit over the edge of the bed. You ready?
Yes.
All right, so let's go. Okay, just want you to sit there for a minute. Just let your knee bend a little bit.
We always use a gait guide, such as a 4-point walker. How far you walk that first day varies from patient to patient. Generally, you can put as much weight on your operated leg as feels comfortable.
Okay, so push up from the bed, one hand on the walker. You can put your operated leg down. How does it feel?
Fine. Feels good.
Okay, we're all unplugged, so the sequence is walker first, operated leg, followed by a good leg. Good.
Exercises are resumed your first day in hospital. These will be familiar since you would have started to do them prior to your surgery.
Okay, Darlene, we're going to go through the exercises with you. So the first thing I'm going to get you to do is just pumping your ankles up and down, just to get the circulation going. Good. Now I'm going to get you to point your toes up towards your face. You're going to push your knee down into the bed and you're going to tighten up your muscles. You're going to hold for a slow count of 5 and then slowly relax. Good. And once more. Excellent. Okay, and relax again. Now this time I want you to pull your toes up towards your face. Keep this knee straight. You can bend this other knee, just helps your lower back. Okay, and you're going to lift your whole leg about 6 inches off the bed, keeping your knee as straight as you can, and hold for a count of 5. Excellent. And slowly bring it down. And once more. Good. And down. Now the next time you lift it up, I'm going to put the juice can under your knee. So pull your toes up. Good. And just let your knee bend a little bit. Okay, again, pull your toes up towards your face, push your knee down, and straighten out your leg. Hold for a count of 5, and slowly bring it down. And once more. Good. I'm going to take the juice can out. I'm going to put a plastic bag under your heel, and I'm going to get you just to work a little bit on bending. So just slowly slide your heel on the bed, letting your knee bend up as much as you feel comfortable. You should have a slight pull, and then just slowly straighten out your knee again. And once more. Good.
After surgery, you will want to reduce the swelling in your knee. An important way to do this is elevating your leg with pillows. Cold therapy in the form of ice packs or a cryocuff, as demonstrated, can also help reduce pain and swelling. You should expect to have some discomfort with the exercises. If you do not push yourself and work through the pain, you will not have the results you want following surgery. Ice and prescribed pain medication will help you manage your pain. It is your responsibility to do the exercises 3 times daily, 10 repetitions of each exercise, while in hospital and at home. Subsequent visits to the physiotherapist post-discharge will progress these exercises.
The goals after total knee surgery are full extension or straightening of your operated leg, functional flexion or bending of your knee, reduction of swelling in your knee, and improving the strength of the muscles around the new joint.
You will be discharged home with your staples still in and a date to return for their removal. Follow-up with your physician will take place in approximately 6 weeks post-operatively. He will want to see approximately 90 to 110 degrees of knee flexion and improving strength.
Here are a few pointers to make your trip home easier. Recline the car seat as far back as possible. Move the whole seat back. Use a wedge cushion on the seat. And lower the passenger window so you will have somewhere to place your hand. You will need to elevate your leg with pillows and apply ice when it is swollen. Ice at least 3 to 4 times per day at home for 15 minutes. Icing may be needed as often as every 2 hours to reduce inflammation and pain. Swelling may also increase as you become more active, so it is important to do your ankle pumping hourly when awake. Lie down flat and raise your legs higher than your heart by placing pillows lengthwise under your legs.
I find too that if I have too much activity at some time and I've done too many exercises or even too much gardening and I find my knee swelling up, I'll just lie down and put some ice on it and cool it down for a while, and then I'm back to normal again.
It is recommended that you continue your exercises after discharge from physiotherapy. If you do not continue to stretch and strengthen the muscles around your knee for the first year, you may find that over time the joint will stiffen. Getting the best results from your surgery depends on your determination and following through on your exercises every day.
I did my exercises faithfully every day. I think that is the most important thing about the recuperation period. I elevated when my knee was swollen. I iced it 4 times a day, every day without fail. I did the exercises that the physios taught us to do here, both prior to the surgery, when I was here recuperating, and then when I went home. And I still continue to do the exercises.
Well, life has been just wonderful after surgery. I can remember right after my first surgery, about 3 months later, my daughter and I were walking around shopping, and I kept saying to her, "Isn't this wonderful? I can walk again. I have no pain." Well, soon after that, the other knee gave out, so I've had them both done now. And it's just wonderful.